our first podcast. We were initially going to do this live, but I think it was just a little bit better and more convenient to be able to record it and send it out to everybody just to kind of make sure we're not violating any HIPAA. If people ask some personal questions this way, this could be more accessible to more people and be more beneficial. I want to introduce Dr. Lancer and Yaffa. They are child psychiatry. Is that correct?
Yeah.
Yeah. Okay. So, yeah, we decided to put this together to kind of provide our families and any families in the ABA world an opportunity to, ask some questions and get some insight from your perspective. So I'm gonna pass it over to you both so you guys can introduce yourselves a little bit better than I did.
Sure. Yaffa, go ahead.
You'd like me to start?
Yeah.
Awesome. Okay, I'm Yaffa Gordon. I'm a pediatric physician assistant. I've worked in general pediatrics for over 10 years. In the process, I had the opportunity of seeing many, many children on a regular basis, between probably 30 and 40 patients a day. And aside from the ear infections and the strep throats that I was treating, I noted that families needed a lot more handholding and a lot more love and attention and listening ears for what they were really going through. So I spent a lot of time in the pediatric world, managing kids with ADHD, managing behavioral challenges and differences, autism, and comorbidities. Additionally, I have a beautiful 15-year-old son who has ADHD, and it's been a personal journey for myself. And professionally coupled with personal, journeys and trying to figure out how to best support my family and the village it takes to take care of kids with neurodivergent challenges, behaviors is a journey for life. So I've been now working with Dr. Lancer for about a year, a little bit over a year. We met, as Dr. Lancer can tell you more, we met as Dr. Lancer came down here and he was looking to really create a beautiful vision and program where we would help kids and families with autism and ADHD be able to navigate the difficulties and challenges that come along with it. And he reached out to me. He had heard of, my name and that I was in pediatrics for a long time. And I shared with him my vision. And he said, I love the vision. It's my vision, too. I've had that in mind also for years. Let's partner up and let's work together. So I moved away from general pediatrics on a regular basis. I do still work per diem, but I moved away from that. And together with Dr. Lancer, we opened a beautiful practice and program geared towards families with children with ADHD and autism and everything that comes along with that, not only to provide medication management if that's something that the family is interested in or the child needs, but to really help case coordinate and make sure they have the right ABA therapist, they have the right psychotherapist, they have the right OT, they're in the right school, they're connected to the right teachers. And really that was our goal. And thank God we have grown tremendously and we continue to hopefully do good things for everyone. So I'll pass the mic over to Dr. Lancer and he can tell you a little bit about himself.
All right. So yeah, I'm Dr. Lancer Nagdachi. I'm a double board certified child, adolescent, and adult psychiatrist. I see kids of all ages. I see adults of all ages. I see all acuities. And, I developed my practice, just to be more accessible to people in general. Because I know it's very hard navigating mental health, and especially when it's for your child. And especially when it comes to behavioral children, it becomes a multi-layered issue. And so that's why when I found Yaffa, we had this vision of having like basically a white glove service where we're holding the family's hand through the process and guiding them, not just in terms of diagnosis and medication management, but in terms of who to see and where to go and who to trust.
I love that. And I think that's so important, especially when you're first getting that diagnosis. There's a lot of anxiety surrounding, like, what do I do? Where do I go from here? So it's good you do a little bit of that hand holding and guidance. I think this is a good segue into the first question I want to ask, because there's a lot of sometimes confusion when it comes to all these different roles. You have your pediatrician, there's ABA, there's OT, there's SLP. And I know there's a big there's some confusion around psychologist for psychiatrist.
Mhm.
So can you talk a little bit about like what role does a child psychiatrist play in supporting children with autism, and how does that different from other professionals like pediatricians, psychologists, neurologists, etc.?
Sure. So let's start with just what's a psychiatrist. So a psychiatrist is a medical doctor. So they either have an MD degree or a DO degree. They went to medical school, and instead of being a surgeon or a pediatrician or a family doctor, they became a psychiatrist. And so you do a 4-year residency in general psychiatry, and then you do a 2-year subspecialty in child and adolescent psychiatry. Um, Psychiatrists not only can diagnose and prescribe, but they can do therapy, and they pretty much can do almost they're the highest trained people in terms of the different professions. And then there's psychologists. Psychologists are doctors. They have a doctorate in psychology. And so there are basically two kinds of psychologists. There is just the regular run-of-the-mill psychologists, and then there are special psychologists called neuropsychologists. And the neuropsychologists have extra special training, and they can do some cognitive evaluations and some psychological evaluations. Sometimes they go by names like neuropsychological evaluation or psychoeducational evaluation. So these things tell you if there's any learning disability or any processing issue, things like dyslexia. And so a lot of times it's important to kind of, if rule out whether there's a learning disability or not. And so sometimes they'll go to the neuropsychologist first and then come to us, or sometimes they'll come to us first and then we'll say, we think there's something more than just a psychological or psychiatric issue, and we'll send them to get more further testing. And then you have all your other professions like the occupational therapists, speech therapists. Yaffa, help me out here.
EBA therapists, psychotherapists, equine therapists, art therapists, all different therapists. Although psychologists, Dr. Lancer, correct me if I'm wrong, psychologists can practice therapy as well, correct? Aside
Psychologists
from
are
testing?
therapists. Yes, psychologists
Okay.
are therapy. Therapy is a very general word. Psychotherapy is talk therapy, is what we think of when we say therapist. And so psychologists are kind of like more or less the experts in psychotherapy. It used to be psychiatrists. Psychiatrists in recent years have kind of moved on to just doing the prescribing. It's very rare to find a psychiatrist that also does therapy. I do therapy myself, but again, I always tell my patients there are people much better than me that do therapy, and much cheaper than me that do therapy. And so, the psychologists, I would say, are the experts in psychotherapy. And then you have master's level therapists. So these are people that don't have a doctorate in psychology. So they might be marriage and family therapists, or they might be mental health counselors, or
LCSW, right?
social workers, correct, social workers. So these are people that have master's degree levels in psychotherapy.
Okay. So yeah, there's a lot to sort through. Let's make it a little easier. If people wanted to come to Dr. Lancer from the autism community, right? Because that's probably who's going to be watching this. What services can they expect from you?
So, first we would do the in-home evaluation. So Yaffa and I will come to the home. We'll talk to the parents, we'll talk to the child, talk to the family, see how the child interacts with maybe their siblings. We'll check out the child's room. We'll talk to the child's pediatrician, school, whoever else may be involved in the child's care. After we do our evaluation, we'll come up with a diagnosis and a treatment plan. Part of that treatment plan will be finding this family different resources and different professionals, maybe an ABA company like yourself, or a speech therapist or occupational therapist, or all of the above. And once we have that care team in place, we'll have a meeting with everybody and get everybody on the same page. Yaffa does a lot of the behind the scenes work, a lot of the heavy lifting, talking to the schools, talking to the therapists, to the pediatricians, making sure everyone's on the same page again. And we really we make ourselves available. We give our patients our cell phone numbers with any medication changes, any side effects. We're there at every step of the process.
So you do the evaluation to diagnose for autism?
Mm-hmm.
Okay. And then what about a family who already has a diagnosis? They're in ABA, they're in OT, so they need a little bit less of that handholding, but they are considering potentially going the medication route. What does that look like if they were to call you?
Similar process, a little bit less involved, but it still would include an initial visit, and that's basically a longer visit. It would take between 2 and 3 hours. Sometimes it can be done on Zoom. Sometimes we do it in the home. Again, we have to come up with our own diagnosis. You can't just go to one doctor, get a diagnosis, and go to another one and say, "I have this diagnosis. I'll take your word for it."
Yeah.
So, we do our own evaluation, and then same thing. We come up with a treatment plan and execute it.
Excellent. So, I mean, that sounds pretty accessible to the families, which is great. Do you also offer remote services for families, and not just directly in the home?
Yeah, yeah. So we have kind of two different product lines basically. We have we have our membership package, which is really white glove service over the top, and then we have our a la carte kind of service, which is pay as you go essentially.
We
That's
see patients in the home, we see patients, you know, wherever they want, where they feel most comfortable. Obviously, we try to keep in mind always HIPAA and respect.
yeah,
But if we have a family who's like, we're staying at a hotel and we want you to come to the hotel, or we have we're away for the weekend, or we're on a boat, or we need you to come, we make it easy for families. That's our goal. When we say in home, that's like in quotations, because that's our way of saying you don't have to come out to an office and bring your kids out at a difficult time during the day or the evening. When you have 5 kids or you have one difficult child that you can't imagine bringing outside the house. So that's really why we provide the in-home services. We do provide Zoom services as well. We generally do not recommend as an initial visit doing the Zoom, especially when it comes to kids. Their attention span, even as adults, is very difficult
yeah.
to sit in front of a computer. But definitely thereafter the initial visit, we do Zoom visits or virtual visits at all times of day. 7:30 in the morning, 9 o'clock at night. Really, we make it easy and we try to be as flexible as possible, for our families.
That's excellent. And I know you're located in Florida, but like, what's the geographic range you guys can see? Can you see outside of Florida, or is it just specifically Florida?
So I'm licensed in the states of Florida, New York, and New Jersey.
Okay.
Um, I've seen people in the southern Florida Tri-County region, but I've seen people in Orlando. I've seen people outside of Florida. So, it's really a case by case thing. And again, it's kind of like a tailor-made service. It's not like an algorithmic thing. So every case is a little bit different.
Okay. And I mean, if you ever expand, that's something we definitely want to let the audience know, whoever comes across this video. But I want to segue into, so we know a little bit about your specific services, but I also want to provide some information for individuals who are just looking for information more about psychiatry, right? And this could also apply to the individuals who might be interested in your service. So it seems, just from my experience with the field and just society at large, there's a very negative stigma when it comes to medication, especially medicating children. Um, I mean, from your perspective, like, can you talk a little bit about that? What are some of the pros and the cons? What are the benefits of medication? When should a parent consider, hey, maybe I should consider this route?
It's a great question. Medication, it really varies based on the patient. It varies based on the diagnosis. It varies based on the symptoms. So I don't like making blanket statements, but I like to tell parents a good kind of litmus test of when medication should be considered um, is is your child's are your child's symptoms affecting his life, his academic performance, his social life, is it affecting your life, your marriage, right? So those are all times that we would intervene. Another good question is it affecting his trajectory? Does he have more potential than he already has? We tell parents, it may be, it may be fun being a 7-year-old boy with ADHD, but it becomes exponentially tougher uh, with each step forward in life,
Yeah.
both academically, socially, in terms of relationships, you name it.
Yeah, I mean, I could see it. I mean, as and that has I've seen that with, just some just general behaviors too as kids get older. Sometimes kids are doing things when they're younger, it's cute or whatever, and you're like, okay, if they were 15 doing that,
Yeah.
is that something that will be cute or accepted by their peers? So it can be difficult. I think the difficult thing for a parent to determine here is like, so usually first thing their doctors will prescribe is ABA, behavioral therapy, psychology. We're trying to address these behaviors, and parents want to try to address it through a non-medication means. And it seems that most families these days are enrolled in some type of therapy, even if it's not behavioral therapy. There's OT, speech. So it sounds like they're trying to do it with like the most minimally invasive, I guess you could say, treatment for these concerns. At what point, though, should a parent in this journey say, I mean, obviously from the beginning, they could probably come to you and get assessed, and you guys can give your opinion on maybe we should try those things first. But let's say for that family who already started these other things,
Mhm.
what are some signs they should look for that say, hey, maybe what you're doing isn't enough, or maybe not, that's not the proper terminology. Maybe they could get better or more expedited gains, or more efficient gains, or see further progress if it was supplemented by medication. What are some of those signs we should look for?
I think before we discuss the science, I think it's important to realize that that's why it's so important to work with a team and to really trust the professionals you're working with. Because, for example, if they signed up for ABA, our expectation would be that that ABA had a plan in mind for this child and was able to say, typically in a 2-month period, in a 4-month period, in a 9-month period, we have certain expectations that are typically met. And if those expectations are not being met, that would be a good time to reassess. I think a lot of times parents get very confused because they'll sign up for different types of therapies and modalities, and they have no idea as parents what they're supposed to be seeing, how long this process is. And they'll come to us a lot of times and we'll be like, okay, so what did and I'm not going to name a specific therapy because we're all human, but what did your therapist say? Like, how long do they expect this behavior to abate in? And a lot of times families are like, I don't know. I never asked. I just figured they would tell me. So I think we rely a lot on our interdisciplinary professionals that we work with to also guide us and to navigate us. You as an ABA therapist, like you know best how ABA works and how effective it should be and how long it should take. The same thing with an OT. A lot of times we see kids who have been in these programs for so long, and it's not that they're not benefiting, and it's not that they're not the therapists are just, but is it possible that if they had medication, they would be more receptive to learning the skills that the therapists are trying to, work on with them or teach them? So I think for at least from my perspective, and Dr. Lancer can add, I don't think there's a timeline. I think what Dr. Lancer was saying is that is it affecting the child's overall function? What have you done prior to that? And what are the therapists who are working with you saying? Is this, is this the neuro path or the neurotypical path that we expect in a neurodivergent child to take when they're doing the therapy, or can they benefit from something different?
Yeah, no, I mean, that's a great answer. And even as a professional who's worked in this field for over 10 years with so many different children, I think it is difficult sometimes for us to try to pinpoint like when we should suggest a parent, hey, maybe you should, have your child evaluated by a psychiatrist. Um, because we do tend to see progress in all of our families. I mean, it's obviously varying levels of progress, and there might be some that are just very difficult. So it it's, I mean, difficult to make, progress at the same rate as others. But it is difficult to say, okay, well, I'm not making the progress I want to make, but where I can say from my experience, um, sometimes we do have children. I think one of the signs that's like, okay, this is a barrier to progress. When we have children who have very difficult time attending to the relevant stimuli, or sorry, the relevant pictures would say cards we want them to look at. So if we're trying to teach them to select an item from an array on the table, we want them to find the dog, and it's very difficult for them to even look there because they're, stimming, looking elsewhere, looking at everything around the room, and it's difficult to, shift their attention towards something. And that's a barrier to progress. Sometimes that's a good indicator that, hey, maybe you should go have your child evaluated. There might be something that could be beneficial here from that perspective. And I think it's important for practitioners who are listening to this. When we say that, we are not recommending medication when we say you should get evaluated. We're saying you should speak to a professional who will do the evaluation to see if they need it. We can make that recommendation. Maybe the child doesn't need medication. It could be something else. So those are just some of the things I've seen. And then also some of the older kids, I tend to recommend if there's any ever like language of, self-harm or violence or verbal statements or something like that, I tend to always recommend seeing a psychiatrist. And that's not, again, that's not pointing in direction of medication. That's just making sure we're covering our bases too. Maybe there's something else there that's we can't address behaviorally. And that's definitely a time I want to collaborate. But yeah, that's just from my experience, what I've seen, where sometimes medication has come in and we've seen an effect in the data once they
And I
start.
think, yeah,
Yeah.
I think Dr. Lancer always says, like in our practice, we deprescribe more than we prescribe. So it works the flip side as well. We have patients who come to us who we may recommend the medication, and then 6 months in, we might say, you know what, the medication is doing what it's supposed to be doing, or maybe the medication is not necessarily, what our first line tool is going to be. We need to work with an ABA therapist. We need to be working with a psychotherapist. And we have families come to us all the time, on the contrary, who want the medication. And we have to say to them, really start with an ABA therapist, start with a psychotherapist, start with an OT. So I think we really work very, very closely hand in hand to make sure that I always say all the tools are in the box. Medication is a tool, ABA therapy is a tool. Every tool is used and utilized at a different stage of a child's life.
Yeah,
that's great to hear. Dr. Lancer, did you have something to add to there before I get into specific questions from our families?
Yeah, just in terms of, medication and when to do it and what it does. I always use the example of reading glasses. You can have, your child in the best school, the best teacher, but, if the kid can't see, there's no point. And so
Yeah.
that's kind of what the medications do. They allow the child to participate and absorb everything from all the different therapies. So the medication isn't really fixing the problem. It's, um, I like to say, it just puts air in your tires. You still have to pedal. So, the therapy and the child, they're doing the hard work and the heavy lifting. The medication is just there to help that all happen.
I love the eyeglasses analogy, especially because I'm
Love it.
wearing glasses, and that's actually a really good one, and it's a good way to frame the whole situation. Okay, so I do want to make sure because I know we have 14 minutes left here. I want to make sure we're getting into some of the questions from our families. The first one is, how can a psychiatrist identify if a child with autism and ADHD also has ODD?
So these are all clinical diagnoses.
Mhm.
What does that mean? It means there's no test. People will tell you there are tests. I got this evaluation done. I got this. There's no objective way to tell if a kid has ADHD or autism or ODD. They have to meet a certain certain set of criteria. And I joke with my patients. It's very easy to do what I do if you don't know what you're doing, and it's very hard to do what I do if you do know what you're doing. So it's very easy to go down a checklist and say, okay, he meets all the criteria, but you really have to take a look at the whole picture, psychologically, medically, socially, even spiritually, and culturally. And so you really need to see a professional, someone that knows what they're doing, in order to make sure you have the right diagnosis. That being said, I also tell patients diagnosis is not everything. We don't treat a diagnosis, we treat the person.
I love that. Okay, so the next one here we kind of already answered. It says, how do we know it's time for our child to start medication? We went over this. I think an important thing here. that we should probably touch on, and we kind of already did, but if going to get evaluated by a psychiatrist doesn't necessarily automatically equal your child's going to get medication. Am I incorrect in saying that?
Yeah, just this past week, I did 2 or 3 evaluations, and I left the home without prescribing anything. I prescribed them, ABA therapy or a learning specialist or, a psychotherapist.
Yeah. So I think that's the fear. And I think that's the first barrier. If parents don't feel like I'm automatically going there. And then also can you speak to like a family who's on the fence and you do prescribe? Do you like, so generally when I'm providing an assessment and I'm going to prescribe interventions, right? I tend to go over the pros and cons of this intervention versus this intervention and say, hey, we could do it this way or we could do it this way, and we'll likely get to the same result. This one might be quicker, this one, whatever, but also let's talk about the experience of the child and what that's going to feel like. Do you do a similar thing when you're prescribing medication? Then how much agency does the parent actually have in terms of making the decision of, hey, I do want to move forward with this?
100% the parents. It's only the parents. We have to get consent from the parents, and we also have to get assent from the child, meaning the child has to be on board as well. Obviously, we can't do anything without the parents' consent. What was the
We
other part?
we really try to empower the families. We're the captains of the ship. We're just, passengers carrying them along and giving them, good job, you made a right. Good job, you made a left. It's going to rain. Be careful. We're really trying to help them navigate as they steer the ship. And I would say 100% of our families know that and feel that if they're not ready to start a medication, we're behind them. We're there to support them. We're there to listen to them. We're there to give them other ideas. And then if and when they are ready, we're ready to engage with that process as well. So all our families, they're families to us. We become part of their family. So it's not like some calculated business professional decision. Like these are the pros and cons. You tell us, and it's really like we become part of who they are. We get it. When we have families come and tell us they don't want medication, we've already understood the way they operate. We know their family, their own personal family history. We know their own baggage. Like there's so much that goes into our evaluation. It's not just about the criteria. It's about the entire emotional, process from the parent's own childhood, and what that looks like transferring over to their children.
No, I love that.
You spoke about pros and cons. So when it comes to medication, there's risks and benefits to starting a medicine. There's also risks and benefits to not starting medicine. So ideally, when the risk of side effects of a medication is less than the risk of not starting the medication, then it's kind of an easy decision to make.
Yeah, no, that makes sense. And I think if parents look at it as an informational session, hey, I'm going to view what my options are, right? Not necessarily I'm going and I'm making a decision just because I walked in that door. I'm going to see what my options are for my child. I think that will kind of help parents take that step toward, seeing a psychiatrist just to learn more information at minimum, learn more about their child, and that's what a lot of this is, just learning about their child and how we can help them. Okay, let's move on here. We have 2 more. I want to make sure we get to them. If a child with autism and ADHD is diagnosed with ODD, what does the treatment plan involve?
Yaffa.
We're looking at you. Yeah.
Me?
We're big we're big believers in behavioral modification. And Dr. Lindsay, you can talk a little bit about ODD, for a minute, just from a clinical standpoint to understand what it is. And then I think we can talk about the treatment.
So ODD is, it's a pattern of angry or irritable mood or argumentative or defiant behavior. A lot of times they're vindictive, these kids. And, these are the kids that lose their temper. They have tantrums. They, argue with their parents, with teachers. Maybe they annoy other people on purpose, or they blame other people for things that they've done. And so, there are different, basically different categories of severity of this kind of behavior. There's oppositional defiant disorder, there's DMDD, there's conduct disorder. And so, although there's no medication for ODD, let's say, there are medications that treat either the big picture or specific symptoms. So, if a child has autism and ADHD and ODD, we'd like to find one medicine that kind of checks all the boxes, and maybe something that helps with irritability or impulsivity will kind of, it'll be one medicine that does multiple things.
The reason I said look at you is because I wanted Dr. Lancer to explain there's no specific treatment for ODD. It's not like you can Google online, what are the medications that we treat, ODD with? Yeah. Really, it's a side effect or comorbidity typically with ADHD or autism. Is it true that we have seen children who manifest behaviors of ODD without those diagnoses? Yes. And then we have to look at environmental factors. We have to look at parent sibling dynamic. And that's when we call, to our ABA therapist and we say, hey, go into the house, see what the behaviors look like, see what the environment looks like, what needs to be, how can we help these children to feel better about themselves, incentivize them, reinforce positive behaviors. So a lot of that treatment is more effective for ODD alone. In addition, if there is something like ADHD or autism going on, like Dr. Smith said, treating those symptoms with medication. So I think that's where the confusion sometimes comes in. Like, what medication can I give my tantruming, defiant, rude, disrespectful, throwing chairs at me, medication? And the answer is that's not, we don't treat it with medication.
The treatment is the therapy, but the medication sometimes allows the therapy to happen. That's, it's the same concept as the eyeglasses example.
Yeah, no, and from my perspective, I've seen some scenarios where it just medication it takes the edge off. It makes treatment a little easier. Reduces the magnitude of some of these responses, so it's a little more manageable. So I've seen that in the past, and a lot of the children we get also had that diagnosis of ODD, and we didn't even say ODD stands for oppositional defiant disorder. For those who don't know, so yeah, a lot of the kids we get coming in already have that diagnosis. So there's very specific things we can do to try to address it behaviorally. But I have seen a lot of prescription for medication also, part of that treatment package. We have one more question here, and then I have one more I want to make sure we finish off with. But this question is, how do we know it's something more than autism? Do they have another diagnosis, or how to ask the right questions?
So, I mean, the simple answer to this question is you take your child to a professional that can do a proper evaluation. Ideally, if you ask me, a psychiatrist, a child psychiatrist, that will not only look at psychological and psychiatric issues, but also medical issues. And then if there is a thought or that there might be something more than just medical or psychiatric or psychological, or maybe it's cognitive or like a learning disability or dyslexia or processing issue or a hearing issue or a vision issue, then we would send for further testing to like a neuropsychologist.
I want to reframe the question, what I think the parent's trying to get at. Because as a parent too, I have this question. We know as parents that I don't know the answer to the medical question I'm asking, and a doctor will give me that question, the answer. I think the question is more, when do I know to take my child to get evaluated? Because, taking your child to the doctor, it's not the easiest thing in the world. There's costs involved. There's the trip there, especially children with autism. They might not enjoy going to the doctor. It might be a very unpleasant experience. So it's something generally people want to avoid if they don't have to go, right? In an ideal world, every child gets evaluated all the time. That's just the perfect world, but that's not what we're living in. What are some of the signs that a parent should say, hey, I probably should take that step. It's worth it. I need to go to see a psychiatrist.
So I'd say, a lot of people come to us because the teachers have said something. So that's one clue. If your teachers are telling you something, they're not right all the time, right? Obviously they're biased, but but if you're getting feedback from the teachers, another thing is if it's affecting, the kid's life, the kid's struggling, academically, socially, behaviorally, if the kid's behavior is affecting your life, if you haven't gone out of the house because you have to take care of this kid all the time, if it's affecting your marriage, if it's affecting your own mental health, right? And so these are all signs that something needs to be looked at.
Yeah, if I do have anything to add.
Yeah, I think it just goes back to what you were saying before, Dia. Like, you're not committing to life just because you're going to see a psychiatrist. It's no different than we're getting a dog and we're looking for a puppy. And I have know nothing about a puppy. So I started with ChatGPT and I was like, I feel like that's the right place to look. And then I went to a friend who has a dog and I said, where do I get a dog from? And then I'm like, you know what? I feel like I have to start with a professional. I have to actually ask someone who breeds dogs, or I have to go into a store, that sells dogs, and I have to ask them about the dogs. And maybe I'll like what they say, maybe I won't, but it will give me a better idea of, so I think parents usually start with Google and their friends, and then they're kind of starting to collect information, but get to this point where they're like, I feel like my friend is onto something, but she doesn't really know my kid, or like what she's saying makes sense, but I feel like there's more going on. And then they come to the point where they're like, you know what? I should go get help. So I think there's really like a progression that happens. But like you said before, you're not committing to medication. You're not even committing to services just because you go and you're gaining knowledge, So knowledge is power. I don't think anybody ever, unless it's like bad knowledge, I don't think anybody ever suffered from, getting good advice or getting good knowledge, and whether they took that or not is, the next step. But at least they feel more empowered, and they know what they know, and they know what they don't know, and they know what to look out for. A lot of times families come to us and they're like, okay, we're not ready, but now we know, and we'll come back to you, quote unquote, when it's really bad, or when the teacher then says something, or we'll wait till after the holidays and then, see how it is.
On that note of bad knowledge, you do want to get advice from people who know what they're doing. So teachers are one source, but your pediatrician, if you think something's up and you don't know whether you want to see a psychiatrist or not, ask the pediatrician.
Yeah, no, that's great. Yeah, I would say to a family, if you find yourself continually asking the same question, is it more than autism? Does my child need medication? Can my child benefit from XYZ? If you're asking the same question over and over again, that's your sign to go, get evaluated, go see a psychiatrist. Do we have time for one more question?
Yes, quickly.
So if you could tell every parent of newly diagnosed child one thing, what would it be?
I'll let you go first, Yaffa.
Oh, okay. You're not alone. We're here to help. There's a whole village out there of people who, believe it or not, can relate to you and are probably feeling just as isolated as you are. I know for myself, the journey of having a neurodivergent child can be extremely isolating. But when you find people that really care about you, and you find your village, whether it's your professionals or, your friends who can relate, you realize that you're not alone. And our job is to take care of our kids. You're your child's advocate. You're his or her best advocate. And our children need us. Our children need us to be our voice and to be our advocates and to be brave for them, because a lot of times they're not ready or they're not able to help themselves. So you're not alone, and get help because you're doing it for your child.
Dr. Lancer?
I'd say your child will thank you when they're older.
That's good. And what I've answered this before, and I think it's important for parents to see that diagnosis didn't change your child. Your child, the day before that diagnosis, the child you know and love is the same child after that diagnosis. You just learned something new about them, and that's now opening up the door for you to help get them what they need, to live that rewarding and fulfilling life that all parents want for their kids. So, that, and I think that's just a really important takeaway. We need to learn more about our kids and help them, and that's all we ever care for as parents. So thank you both for all this information, and I hope some families take that step to reach out to you to learn more about their kids and to be able to better help them with whatever they need in life. All right, well, this was great, and hopefully we talk soon. Thank you everybody for listening. And if you have any questions, you can always send some emails and we can put you in touch with Dr. Lancer and Yaffa here.
If you want to reach out, you can call me on my cell phone at 646-363-6303.
Hey, thank you for that. All right.
And thank you. It's been a pleasure speaking with you. And we know the good work that you do, and we look forward to continuing our partnership.
All right. Thank you so much.